I knew Dr. Pratisha Gandhi, and I told her that I want to have the same treatment, okay, because there are so many benefits are there, not only for the heart, rather there are 10 different benefits, and which I'm going to be going over that. And I told her that I want to go through the entire 35 sessions, which I did. I have a lipidologist, cholesterol specialist, I want to confess. And he was telling me that looking at my cholesterol pattern and everything, he told me that I'm at higher risk for a heart attack. So I went through this particular test, tested its procedure, that everything. And 6 months later, I did the blood test. And then I went and saw him. His name is Dr. Triffin, Feminist Triffin. He's a renowned lipidologist. He told me that it is completely normal. Everything is completely within normal limits. Nothing to worry about it at all. What a difference. So I want to give you my personalized experience, and then I want to stop the lecture. So I want to do vascular shield, protecting your brain, body, and heart with the ECP. Unfortunately, I don't get any feedback from you guys because I'm not able to hear anything from you guys. While I'm talking, make sure that you have a way of communicating with me in the mic so that I can answer the questions from the audience. I'm going to show you what is enhanced external counterpulsation. So this is a machine. This is an example of that. The patient is sitting there. He has got 3 cups, okay? Lower in the calf region, the thigh region, and the lower abdomen. And the heart is contracting. When the heart is contracting, the entire body gets the blood supply. When the heart is relaxing, the heart muscle itself will get the blood supply. So you cannot derive the thing from the heart itself. So what it does is, when the heart is contracting, 𝐸𝐞𝐥𝐸 is attached to the patient, and look at this EKG. When the heart is contracting, it doesn't do anything. When the heart starts relaxing, all these cups compress and push the blood with really a lot of power back to the heart. So from the heart, all the blood is going to the heart and the brain. All the arteries in the heart will open up and improve the blood circulation to the heart. So that is a principle. But enormous research has been done, and it is fascinating. I'm so thrilled and delighted to share all the benefits with you. This is another example, and when the pumps are contracting, the blood is going back to the heart and into the arteries. Okay, that's what I'm showing. What is some core cardiovascular benefits? If the patient has angina is because of the blocked arteries of the heart, coronary arteries, and even with a few steps, 10 steps, 15 steps, they'll have chest pressure, tightness, more than. These people are going to have a heart attack. To enhance the angina, when after this treatment, they don't have any problem, they can just keep it walking. Increase the blood flow to the heart, we mentioned that. Enhance collateral circulation. It opens out neural arteries. We call that neurovascularization. So when they do a bypass surgery, when the artery is blocked, they do a bypass surgery. They put another vein and put it in the top where there is no blockage, and then passing the blockage, there's connect. That's called bypass surgery. This one averts the bypass surgery. It opens out all the arteries with so much of pressure in 35 sessions. It opens out all the small arteries, and the arteries will go and supply all the linears to the blockages happen. Will reduce cardiac workload, and you can even reduce the angina medications. Other support, as I mentioned to you, arterial restricted blood supply causes the chest pain, fatigue, and all those things. It also can cause reduced blood supply, can cause inflammation. A lot of inflammation can cause devastating effects like arthritis, muscle pain, all things. And also it increases the mortality. And patients may not be able to sleep well due to lack of blood supply to the brain. Hormonal imbalance, cortisol levels will come down. So a lot of things that's happening. cardiovascular rejuvenation, as well as neurological restorations can happen with the enhanced external pulsations. I will be showing you the artery, okay? Before the treatment, they look at the arteries are constricted and the blood supply is restricted. When the counter pulsation ECP is given, the arteries are dilated, and the dilatation releases nitrous oxide. Nitrous oxide also causes more dilatation. Dilatation is opening of the arteries, so the blood supply will improve, where the blockages cannot do that. This is flow-mediated dilatation. So it's a really fascinating phenomenon. The constant and shear pressure can cause, as I mentioned, oxidized nitric oxide and endothelial growth factor. Okay, endothelium is a lining of the arteries. Okay, so God wanted to protect the arteries so that plaques will not stick to that. So it is like a mosaic tile. Mosaic tile will be there. That is endothelium, and the juncture where the mosaic tiles are there, there's some cement there. That's where, if there is any irritation, inflammation, that's where the plaques start forming. And this one reduces that. It polishes the mosaic road, so it protects the endothelial lining. And also suppresses the inflammation markers. 36% of increased nitrous oxide production and 25% reduction in all the inflammatory markers. So as you see here, the blockage is happening. This is the blockage, this is the artery open. So because of the pressure, all the arteries, the side arteries are open, and it causes new blood vessels, so that the blocked artery area completely is supplied. Blood is supplied, oxygen is supplied, nutrients are supplied. And the patient is able to walk. The patient who had angina, now he is able to hike up the hill. They also estimated that the bronchial artery dilatation, brachial artery is in the arm area, and then femoral artery is in the leg area, nitrous oxide turnover. And most important thing is highly sensitive CRP is an indicator for blocked arteries. That is reduced by 32%. Endothelium, that is also reduced. That also causes inflammation of the artery and causes blood vessel constrict. And TNF-A is also inflammatory markers. They're all reduced after the treatment. This is another example of telling exactly what the clinical result is. 62% reduction in angina. What is the next benefit? The benefits are, other than blocked artery, is chronic, not like chronic, and then left ventricular dysfunction, that is heart failure. Blood vessel heart is not contracting well because of that heart failure is happening. So, and also syndrome X. Syndrome X is a microvascular angina, small, tiny arteries. The patient may have an angiogram, and the angiogram will not show any blocked arterial main arteries. That means the patient has syndrome X. That means small micro arteries are blocked. This also depends on that. And estimatingly, the blood pressure also is coming down. Systolic, as I mentioned here, 78% reduction of healthcare utilization. They don't go to the hospital. 73% reduction in hospitalization. ER visits are reduced by 78%. So because they are much more healthier. Cardiovascular, I showed you that branches and tributes and all that is there. Early hospital burden, I mentioned you, 81% of the patient discharged successfully interrupted after the subsequent episodes. This is also to emphasize the same issue. So then what are the neurological benefits? Okay, it improves the blood circulation to the brain. For memory, it improves the memory. It's multi-infarct dementia. It prevents multi-infarct dementia. What is multi-infarct dementia? Blocked arteries, small, tiny arteries can cause brain infarction. That is like heart attack, brain attack. So multiple small, tiny ones, if they have, multiple strokes can happen. Since they are microscopic strokes, you don't lose the power of your limbs, but it can result in dementia, memory loss. Restless leg syndrome. During the nighttime, they have insomnia, that is sleeplessness, because their legs are constantly moving. Anxiety and depression. Circadian imbalance. And it also improves the sleep. Sleep is extremely important. The reason for that is amyloid and tau proteins. Those are the bad proteins. During the daytime, we think and talk, communicate, read, or see movies and all that. So our brain is continuously working. So during the work, amyloid and tau proteins are accumulated. During the sleep, the brain is not functioning that well. It's relaxing. So blood can go to the brain and wash all these tau proteins, amyloid proteins, so that we can keep your brain in a sane status. If not, then it will get Alzheimer's. Aging causes, which lengthens the lifespan. It's fascinating. This is, for example, the patient with cholesterol here at the left side, the cholesterol is there, and they are on strict diet and taking medicines. That is not enough. After that, they have the ECP, look at this. They are still on the medicine, still on the cholesterol diet. With the ECP, look at the arteries. It's big, opened up, and it's fascinating. 42% increase in the diameter. Again, this was a feature of cardiovascular therapy. Or this also shows that these are the brain cells, improves the blood circulation to the brain and keep the brain occupied really well. It increases sleep, as I mentioned to you. 46 patients were studied with chronic insomnia, and the 35 sessions, they were tracked by Pittsburgh Sleep. It's a very famous one. Pittsburgh Sleep Quality Index dramatically improved. If you look at the left side, they are interrupted sleep, constantly they wake up, and they feel irritable. But after the ECP, look at this calm and nice sleep they have. Similar thing, after the 35, I think the sleep efficiency significantly improves. Quality is also re-emphasizing the same thing. It becomes less than 50% of core index. Okay, so it is definitely prevents increases longevity. It prevents dementia, memory loss, and the loss. Hormone imbalance, as you see here, unblock the arterial flow for 12%, reduces anxiety and depression. Hormone imbalance that can cause increased anxiety and depression, that also is relieved. Similar thing, not only the heart, but also it improves the blood circulation to the brain, to different parts of the brain, so that the brain function will significantly improve. So I mentioned to you, restless leg syndrome is terrible, which causes a lot of insomnia, a lack of sleep, and the agents, some of the agents, medicines we give, they can also cause side effects, significant side effects. Peripheral artery disease, it just opens out all the arteries, enhances the blood circulation to the legs. So amputation, all those things are prevented. The patients who are smoking, the patient with diabetes, they have a significantly increased risk of high cholesterol. The patients, these people who are having increased risk of blocked arteries to the legs, and they end up in having amputation. It improves the endothelial function. We talked about it. Like that kidney perfusion, it improves the renal perfusion really well. And pulmonary circulation, it improves for appropriate oxygen delivery. Also, some of the patients with erectile dysfunction due to nitrous oxide, it causes vasodilation, and their sexual performance will definitely improve. The rehabilitation of the erectile dysfunction in some of the patients with ischemic disease. So a patient with blocked arteries of the heart can also have erectile dysfunction. This one improves not only the heart, but also improves the blood circulation and hence reduces the dysfunction. End-stage coronary disease. End-stage coronary disease. Patients will have bypass surgery, multiple bypass surgery. The patient has had heart attacks in the past. The patient not a good candidate for the surgery. They have three vessels, all the three vessels are blocked. So those kind of patients, this is ideal. That's ideal. It opens up the artery, as I mentioned to you. It's an outpatient treatment. It's a non-invasive, no surgery, nothing at all. Outpatient, everything is done. And as you're lying down, you can listen to music or whatever it is, and all, then it can help it. Improvement in erectile dysfunction is significant, as you see here, without the treatment and with the treatment. Metabolic and quality life benefits improves exercise tolerance. You're able to exercise much better. Reduced fatigue and shortness of breath. Guess what? Hemoglobin A1C comes down by 50%, 20%. The diabetes also is controlled. Diabetic patients will have arthritis. Diabetic patients will have blocked arteries. Diabetic patients will have erectile dysfunction. Diabetic patients will have blocked arteries to the legs, resulting in amputation. So the diabetic patients, this is the best treatment to protect them and make them live longer and healthier without any dementia. They can even reduce the medications for hypertension, diabetes, and angina. Fascinating. Paradox, as I mentioned, this is, you see here, vascular events are reduced by 42%, cardiac events are reduced by 78%, metabolic events by 14%. We talked about this. We talked about this, like almost 12% reduction in hemoglobin A1C. Fasting blood sugar is reduced by 20%. Postprandial blood sugar, that is after lunch, after dinner, blood sugar is reduced by almost 15%. Overall functional and lifestyle improvement. Non-invasive and painless, in anesthesia, no recovery time, you can just go and have it done, go in the morning and have the test, have the procedure for an hour, and then you go back to your work and things like that. Emotional well-being, you feel good, you don't have any symptoms, you feel your exercise tolerance is much better. Knowing that you're going to live longer and healthier without dementia also improves. And a 70 to 80% reduction in ER visits and hospitalization. This is absolutely important. Prevents you from going to the hospital. It's not only a treatment for the patient, but also for the family members. If you are going to go to the hospital frequently and ER, it's a torture for the family. This one will prevent. And also the cost, hospitalization costs enormous amount of money. This prevents at 1% of the cost. Which hospitalization in San Diego costs about $16,000. So if you're going to be frequently going to the emergency room and hospitalization, you can imagine how much choking. And then one of the times you're going to die. Instead, you can have this procedure for just 35 sessions. You can go longer, healthier, and with the brain function, good brain function. I feel that it is a scientific. It makes a lot of sense. It's also improving the exercise intolerance. So this also helps electrical flow. Fascinatingly, one of the common causes of stroke is atrial fibrillation. We call that paroxysmal atrial fibrillation. And also the mechanical thing is, blocked arteries and all those things. It takes care of both of them at the same time. ECP conditions where ECP is not appropriate, unstable angina. Then the patient just got severe angina frequently. Those patients, it is not. So we will be doing that. Aortic insufficiency, the aortic valve, which is not working properly, and there is a lot of leak in the aorta. This treatment is not going to be very effective. And also uncontrolled hypertension, we don't want to do this because temporarily it might open the arteries, and we don't want that to, because the hypertension, because we don't want them to burst. Aortic aneurysm, and aneurysm, main artery for the heart, which is going to the belly area, If there is open, dilated, then we don't want to do that. Active DVT. DVT is a blood clot in the calf region because we're putting the cuff in the calf that can discharge the clot and that can go into the lungs and cause a condition called pulmonary embolism. So all these things can be prevented. Ripple effect, clinical efficiency, terminating the supraventricular tachycardia, rapid heart rate that can cause stroke or death, reducing angina, as I mentioned to you, restoring the healthy sleep architecture. Physiological tone increases the nitric oxide, reduces all the inflammatory markers, calms the neurological area completely. And real world economics is resume the autonomy to the patient, and 91% reduction in supraventricular tachycardia and ER admissions and hospitalization. And it is overall, in my opinion, fascinating outpatient treatment, and which is kept as a secret. Again, initially I also did not believe, but I reviewed 144 articles. I didn't review each one of them because they are 15 pages to 50 pages each. But I asked AI to summarize, uploaded these articles, and then AI to summarize with bullet points. And that's how I learned. It is fascinating. And my goal is to propagate it to everybody because I believe in spreading the word proactive prevention. And that's the reason why I wanted to do that. Again, as I mentioned to you here, refractory angina, several studies, 83% reduction in hospitalization in 6 months. Long-term survival, 5-year survival rate is 88%. Okay? If without the treatment, people would have been dead and gone. 88% increased lifespan. Angina, do you assess so that they can exercise better? It's really fascinating. Non-invasive, FDA cleared, IV tolerable. So some of you may ask, zero sleep, it's a sleep treatment. Zero sleep, drug side effects, no drug side effects. So you may be wondering how come I have a cardiologist, why is it they don't recommend this? Guess what? They cannot do this procedure. They can do angiogram and stent replacement, and they can, so that's one of the reasons why they are focusing on. I'm not going to say that they want to make more money, and I'm not going to say that, but this is what they are focusing on. And they don't focus on aggressive prevention. Yes. The body knows how to heal. It just needs you to catalyst. The science is definitive. 35 sessions to clear the inflammation, unblock your arteries, eliminate the chest pain, and restore deep sleep. Reclaim your circulation, reclaim your life. I have a YouTube channel, and it's called Clinical Nexus. I'm planning on posting a lot of proactive, preventive topics I'm going to be covering because I want to give back to the community. So all my knowledge, I don't want that to go waste. All my teaching, many physicians. There are at least 5,000 physicians who are practicing. They're all my students in my office. I train them. Anyway, all those knowledge, I don't want that to go waste. I want to go directly to the public, the community. I want to make sure that they get benefited by all. Thank you very much.